Osteoporosis is loss of bone density, making it more porous and fragile and breakage, as shown in this photo of a normal bone and a porous bone as a result of osteoporosis. Common areas of breakage are the wrists, hips, and spine, with increased inability to maintain posture, causing a humpback called kyphosis, as illustrated in this photo. Bone density is the result of heredity, nutrition, exercise, and estrogen. Estrogen is a hormone found in women more than men, and is partly responsible for bone mass. Loss of bone density occurs gradually, beginning between age 35 and 40 years of age, continuing as a normal part of aging. The Surgeon General reports that by 2020, 1 in 2 Americans aged 50 years or older will be at risk for fractures from osteoporosis or loss of bone mass.
Osteoporosis is broken up into 2 different classifications. The most common type is the primary osteoporosis, and it happens because of estrogen loss and occurs in postmenopausal women between the ages of 50 and 75. The second type is secondary osteoporosis, and that affects men and women over 70 years old, but it's still more commonly found in women. It is related to changes that go along with the normal aging process. Bones get weaker and they're more likely to break. It can also be caused by different diseases that affect the formation of bones, such as endocrine disorders. So make sure if you or your family members fall within this age range to speak to your doctor regarding osteoporosis.
Some of the signs and symptoms that a person with osteoporosis develop are pain and fractures, and that depends on the bone that is involved. On the long bones, they get fractures on the femur, humerus, radius, ribs, and on elderly people is common to get fracture on the neck of the femur, which is known as a hip fracture. And on the short bones, we have the vertebrae, they become misshapen, so the person develops kyphosis, which is known as a hunchback. A person died because of the complication of the fractures.
People who are at risk for osteoporosis are women. As you can see here, fracture caused by osteoporosis are twice as common in women as they are in men, due to women starting with a lower bone density. Also, the elderly, as you can see here, Caucasians and Southeast Asians, tobacco users, and men and women with a deficient diet who have anorexia nervosa and bulimia, because they are at risk for a lower bone density.
Start. Ways to treat osteoporosis include hormone therapy and home remedies. Some of the hormones include Avista, calcitonin, Forteo, and tamoxifen. Other ways to treat osteoporosis are home remedies, which would include stuff like avoiding hazards around the house, managing pain, and lifting mechanics. Lifting mechanics include keep the back straight, knees bent, and lift with your legs.
There are several steps you can take in preventing osteoporosis. The first is through proper diet and nutrition. It is thought that inadequate calcium intake may contribute to the development of osteoporosis. Calcium can be found in milk, as fortified, and calcium supplements. And you'll also need vitamin D, which allows proper absorption of calcium in the bones. Secondly, weight-bearing exercises such as hiking, walking, jogging, or weightlifting can help prevent osteoporosis. Third, you can talk to your healthcare provider if you have any questions or need information regarding the disease. And fourth, getting a bone mineral density scan, which detects the mass of the bones, may help prevent osteoporosis. From a bone mineral density scan, the healthcare provider can determine whether or not further treatment such as medication may be necessary.